And here you can see we showed a significant decrease in the pathogens of not just SARS-CoV-2, but other pathogens when we tested in the presence of air filtration units. And this is another example where you can see 3 squares here. That's week 1, week 2, and week 3. And in week 1, we tested the air, captured it with those anthrax samplers, and used the fluidized biomark methodology that we'd validated to quantify and qualify, i.e. tell us what's there and how much of it is there in those tiny, tiny bioaerosols. And we did it first in week 1 with the air filtrations present but switched off air filtration units. And then in week 2 they were present and switched on. And in week 3 we switched them off again. As I can see, SARS-CoV-2 was absent in the week when the air filtrations were switched on. And to our knowledge, we're the first group to have shown this. And the reason why I thought it would be useful to do this is to see whether we could adapt our technology to show whether there was any microbial scientific evidence that underlay the use of these air filtration units, because I was unable to find any prior to our work, including having done a wide literature search. And interestingly enough, because we had the capability, we looked for all sorts of other pathogens as well. And you can see here in week 1 that there are many other pathogens in the air, both fungi and viruses, not just COVID, fungi and viruses, other types of viruses and bacteria, and they all went when we switched the air filtration on. There's virtually nothing. Air filtration is a sensible way forward economically and strategically, and it's also very flexible. So in summary, what I'd like to message, or the message that I would like to get across really, is our ability to capture those tiny bioaerosols that cause airborne transmission of disease is new, it's effective, it's worked, it's peer-reviewed and published. And we believe, and I believe, and my colleagues in my group believe, that we've got a new solution that will strengthen current capabilities of what we have on the wards